Hello viewers, I'm Doris Maduforo and I will be discussing about health and social care sectors amid COVID-19, highlighting the challenges, opportunity and future perspective. I'm going to to, to do introduction now. As we all know, health and social care sectors encompass a broad sectors of service aim of promoting and maintaining the well-being of individual. In recent years, the sector has faced challenges with the global outbreak of COVID pandemic, serving as provide distributor. Um, in, I'm gonna say a little bit of story about the COVID impact and carer perspective. Changes in demand for health and social care professional, higher demand for health care professional, shift in specialized skills, etc. Carer perspective in social care sector. The social care sector offer devices and fulfill carer pathways for individuals dedicated for making positive impact on the life of on the okay. For instance, during the COVID, it was March. I was walking through the COVID. I was so scared to go to work. And when you're going to work, I don't use public because of the COVID disease. I normally use taxi or Uber to go to work. And when we go, there's a lot of distance. It can't be close to your client. You'll be far from the family, even the client. You'll be far from him sometimes. And there's a lot of diseases, and there's a lot of sign you can know when if you have COVID based on you can have like the sign of it. You when something like diarrhea, if you are coughing, if you have something like coughing, and if your body is shivering, you know that you have the sign of COVID. And another thing, the COVID, it damaged a lot of things. So at the point, it damaged a lot of things, which couldn't make me I couldn't taking care of the cakes. I stopped going to work, and a lot of things. The kids, their a lot of their activities, they quit from it. They couldn't go for their activities because most of the activities they stop it because of COVID-19, and we have a lot of challenges going out, making things is very difficult, even to do a shopping, to meet the families. You can't meet your family. You'll be indoors. You'll be bored. It's a lot of things that cause the damage is too much. But okay, even I was worried. Even back home, I have to keep in touch with them, knowing how they're doing back home, because the COVID back home, I think it's like it's like worse than here. And it was too much. I was worried about my mom, which is aging, and my sisters too, and my brothers. So it was too much in it was too much then. And the whole family was scared. Everybody was worried. A lot of things stopped: working out, doing your daily activities. So many things stops then. And you are scared. You can even from your window, saying hello to someone. You can't even be close to anyone of any of your family. In short, COVID-19 taught me a big lesson, which up to now, and even in my cakes, when I sometimes I sit them down and tell them what really happened, because then they didn't know much because they are small, so they didn't know much about the COVID-19. But I sometimes I normally call them and sit them down and tell them what really happened then when COVID-19 it is. As I said earlier, the symptoms of COVID-19 that you can know when COVID is, if you feel like this is COVID, or you feel like uh, yeah, it's COVID-19. As I said, COVID symptoms of COVID-19 is headache, sore throat, blocked and running nose, loss of appetite, diarrhea, feeling sick or being sick. That's what you're going to know when the symptoms is coming, and you can know the symptoms is coming to you. Mhm. Well, according to the recent news, England England top doctor has warned pressure on NHS hospitals this winter is not letting up, with thousands thousands more patients in hospital compared to the same time last year. New weekly figures show there were 3,372 more patients in the hospital each day last week. 97,934 than the same period in 2023, despite the NHS having over 2,700 and more beds compared the same week last year. 10,557 Virex stroke 10,855 included 99,887 cold beds. Bed compares the higher with 94%. Okay. The general acute bed occupied in a week ending 11 February, up from 93% last year. Okay. The NHS started planning for this winter earlier than ever before, with robust measures in place to manage demand, included more beds, nukes, ambulance, and expanding measures such as care traffic control centers, virus ward, urgent community response teams, and the same day emergency care. Okay. Recommendation: the pandemic reviewed potential. Okay, what to do if you have symptoms of COVID-19? Try to stay at home and avoid contact with other people if you or your child have symptoms. Neither have a higher temperature, do not feel well enough to go to work, school, childcare, or do your normal activities. You can go back to your normal activities when you feel better or do not have a higher temperature. If your child has mild symptoms such as running nose, sore throat, or mild cough, and they feel well enough, then you can go to school or childcare. If you are eligible for treatment for COVID-19, you should take care. You should take a rapid lateral flow test as soon as you get the symptoms. What to do if you have tested positive? You are no longer required to the COVID-19 rapid lateral flow test if you have something symptoms. But if you or your child have tested positive for COVID-19, try to stay at home, avoid with other people for 3 days the after the day you tested was taken if you have or your child are under 18 years older. Children and young people tend to be infection to be other people for less time than adults. Try to stay at home. Avoid contact with other people for 5 days after the day you tested or you took test if you are 18 years under or over. Avoid meeting people who more likely to get seriously illness from various such as people who are such as people with a weakness immune system for 10 days after the day you took your test. Okay. The pandemic revealed potential opportunities for carer development in the area below. One, digital health. Two, mental health and well-being. Three, innovation in healthcare delivery, global collaboration and networking frontline contribution. Okay, before I conclude, I want to talk about NHS feature. As a medicine, before I conclude, I want to talk about NHS long time plan. As medicine, advanced health needs changes and society. Develop the NHS has to continue moving forward so that in 10 years, in 10 years times, we have to service fit for the future. The NHS long-time plan is drawing up by frontline staff, patients, groups, and national spark to ambition, but realistic. Okay. Integrated care. The introduction of integrated care systems held not just new structure but new emphasis of openings to working alongside others, ensuring collaboration rather than competition. There will also be increased opportunity to scale up what works, sharing learning and resources. This will included extended people servicing support to area of the health service to have had a little access in the past, such as primary care, and the nature of healthcare service. Thank you so much for listening.